I'm Robert Demeff, a physician with Texas Orthopedic Associates, and I want to talk a bit about amniotic and umbilical cord tissues in the treatment of musculoskeletal injuries. Now, these tissues have been used for a long time, but in the last 5 years or so, it's been much more popular in treating musculoskeletal injuries here in the United States and abroad. Now, this is part of the regenerative medicine that we talk about. And regenerative medicine basically is that the tissue repairs itself. So whenever you have an injury, you have this inflammatory cascade that evolves, and eventually growth factors in cells get released and attracted to the area, and it stimulates a healing response. And so with regenerative medicine, our idea is to use immature cells, or so-called stem cells, to repair tissues. Now, as a refresher, there's basically 4 types of so-called stem cells, the way I look at it. The first are embryonic, which are rather controversial and have ethical issues involved. The second are adult-induced pluripotential cells. We take adult cells and manipulate those to become more immature and therefore more stem cell-like to help repair tissues. The third source is from the patient themselves, whether that's their bone marrow, fat, periosteum, etc. And the fourth, which is the one I'm going to talk about today, are fetal tissues, meaning amniotic, placental, or umbilical tissues. Now, simplistically, stem cells are these premature cells or immature cells that can propagate themselves or can turn into progenitor cells that become other tissues. But the reality is it's a much more complicated situation than that. And these so-called stem cells, regardless of where they're from, have a lot of different functions in terms of upregulating gene activity, increasing protein synthesis, downregulating synthesis of other compounds, etc. It's a very, very complicated field that we only know literally a tip of the iceberg. But if we focus on amniotic tissues in umbilical cord, the reason why these can be attractive tissues for healing musculoskeletal injuries are that they contain, some of them contain cells, and some of them contain growth factors and hyaluronic acid and other compounds that do help stimulate this reparative process. Now, if we look at amniotic fluid grafting, basically amniotic fluid is fetal urine. And it's collected near the time of delivery, and it has lots of growth factors in there, but there's no viable cells. So the companies will collect this amniotic fluid, dry it up, and you have these growth factors that have a shelf life for 5 years or longer. We reconstitute those with some saline or lidocaine and then inject those growth factors into an area that we want to get to heal, whether it's an arthritic joint or a tendon or a ligament problem. Amniotic membranes, on the other hand, also have a lot of growth factors, but again, no viable cells, but it does have hyaluronic acid, and hyaluronic acid is a building block protein, or I should say building block saccharide, that has a lot of different functions within the cells. And so there's a difference between the membrane and the fluid. The fluid has growth factors, the membrane has growth factors along with hyaluronic acid and other compounds. Now, if we move to the umbilical cord, we can use either umbilical cord blood or the umbilical cord extracellular matrix. Now, when the blood is collected at the time of delivery, the companies that process this will basically make sure that it's pure, that there's no risk of infection. They do all sorts of testing to collect this cord blood. And it has a lot of what we call hematopoietic stem cells. And we think that these promote cartilage or bone health as opposed to the mesenchymal stem cells. And also the cord blood has growth factors in it as well. So when you're getting umbilical cord products, you're getting cells as well as growth factors. Now, when we look at the umbilical cord matrix, that's what we call the Wharton's jelly, which is the tissue that surrounds the umbilical blood vessels. And this has a lot of mesenchymal stem cells as opposed to hematopoietic, has a lot of growth factors, and because it's the extracellular matrix, it also has hyaluronic acid in it. So you're getting a lot of different compounds. And again, the idea behind these treatments are to use these injection of cells, growth factors, and extracellular matrix to try to accelerate a healing response. Now, as a reminder, hyaluronic acid is a compound. It's a disaccharide. It's a sugar molecule that has a lot of different properties in terms of providing joint health, being viscoelastic in the joint, promoting healthy water within the joint. It's structural for ligament, tendon, and cartilage. It's anti-inflammatory in that it blocks inflammation, and it also blocks pain as well. So the hyaluronic acid that's injected along with these compounds can be beneficial as well. Now, one of the problems with these umbilical cord products and amniotic tissue is that we don't have a lot of studies. There's some studies out there that show that they are beneficial, but we still don't know the best number of cells, the best concentration of growth factors. It's one of these things that certainly people are researching, but as it stands right now, most of us feel that these compounds can be beneficial for a variety of musculoskeletal problems, arthritis, tendon, ligament injuries, because it includes relatively immature cells that can help differentiate and stimulate a healing response. It has growth factors to allow the cells that are there to become more metabolically active. And the extracellular matrix, namely the hyaluronic acid, also has properties that are beneficial, certainly for arthritis and potentially for tendon as well. Now, we don't know how many cells are ideal. We don't know the concentration of growth factors that are ideal. We don't know how often this needs to be retreated. Is it a one-time injection? Is it multiple injections? It is relatively expensive because of all the processing that has to be undertaken, but it does seem to be a very good option for lots of musculoskeletal problems. Certainly the clinical trials are somewhat limited, but I think most of us feel that this is going to be a helpful tool in taking care of a variety of musculoskeletal problems. If you have further questions, you can go to some of the links that are listed at the end of this video. Thank you.